Welcome to the show discussing problems and issues of health with Dr. Alcena. For this segment of the show, I'm going to continue to talk about hematology issues. If you remember, a few weeks ago, I did 10 shows on clottings in the human body. In this segment, I'm starting bleeding disorders, bleeding diseases, which is really the opposite of clotting. And it's the most fascinating subject in the entire specialty of hematology. It is fascinating. It's complicated, it's complex, whatever term you want to use. It's very difficult to comprehend, etc., etc. Most people, frankly, just shy away from it. Now, there are many, many bleeding diseases in the world, and I'm going to enumerate them for you. And then in time, I will dissect some of them for you so that you could have a complete understanding of what these things are. The number one bleeding disorder in the world, bleeding disease, is of course something called von Willebrand disease. There are 110 million folks across the world who suffer from von Willebrand disease, and in this country, 2.8 million people have von Willebrand disease. Very, very common problem. The other common bleeding disease that people talk about a lot is hemophilia A and hemophilia B. The hemophilias occur mostly in men, okay? Together, there are 18 million folks with hemophilia in this country. 80% of them are hemophilia A, 20% are hemophilia B. Altogether in the world, there are 400,000 folks who suffer from hemophilia A, and 20% of them, of course, have hemophilia A of the 400,000, that representing 80,000. 20% is 80,000. 20%, 80,000 is 20% of 400,000. And as far as hemophilia B is concerned, hemophilia B altogether in this country, 3,600 folks have hemophilia B. Okay, it's less common than hemophilia A. All right, so this is what the story is. And of course, what one has to remember, which you probably never heard before, but you're about to hear it now, 25% of hemophilias can develop spontaneously. That is, people who didn't inherit the problem, and during adult time, for whatever reason, 25% of them develop hemophilia spontaneously. This makes it clear how important it is to properly screen individuals who are about to have a surgical procedure done, because you have all these folks walking around with underlying bleeding diseases that they know nothing about, and then suddenly they're about to have surgery, and we do the basics, and the basic frequently is not enough to diagnose this problem. The basics satisfy the so-called standard of practice, but the standard of practice quite frequently is not sufficient. It covers you in front of your peers and medical legally, blah, 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 blah. But frankly, in terms of patient care, the basic, frankly, is just that, the basic. Now, I'm going to enumerate for you the different bleeding diseases that are known. You have von Willebrand disease, of course, that's number one, 110 million folks worldwide, 2.8 million people in this country. Then you have hemophilia A, 400,000 people worldwide have hemophilia A. 18,000 folks altogether have hemophilia in this country, a combination of A plus B. And then hemophilia B is part of the 18,000. Then you got fibrinogen deficiency, that's factor one, okay? Fibrinogenemia, that is people who have no fibrinogen, not just the deficiency, they have no fibrinogen, okay? You can't clot without having fibrinogen. Then there's another condition called hypofibrinogenemia, okay? Factor 2, that's prothrombin deficiency. Factor 5 deficiency. Factor 7 deficiency. Factor 10 deficiency. Factor 11 deficiency. Factor 13 deficiency, okay? Now the other, von Willebrand disease, of course, is the number one platelet disorder. Then there are other platelet disorders such as Glanzmann thrombocythemia, Bernard-Soulier syndrome, gray platelet syndrome, platelet storage pool disease. These are the other platelet problems. Now, other disease that can cause people to bleed are, of course, alpha 2 antiplasmin deficiency, alpha 1 antitrypsin deficiency, Ehlers-Danlos syndrome, Osler-Wendoux syndrome, vitamin C deficiency, vitamin K deficiency, cirrhosis of the liver, DIC, disseminated intravascular coagulopathy. Okay, this is a mouthful. Okay, obviously, it's going to take me several weeks to do this show, this series, and I will pick some of them that I will describe for you in detail. The others, I'll just mention them because they're not as common. So let's give you an overview of the most common one, of course, which is von Willebrand disease. Okay, von Willebrand disease is a platelet abnormality. The platelet is a cell that circulates in the blood. It has no particular shape to it. When one gets caught, the first line of defense is the platelet that goes toward the site where the cut occurred to try to aggregate to form a clot to stop the bleeding. That occurs because of platelet. Okay, that occurs because of platelet. Okay, the platelet aggregates, causes a clot to occur and seal the place that's just been cut. Okay, very, very complicated issue. Okay, now there are three. Both men and women have von Willebrand disease equally. There are, however, three separate subtypes of von Willebrand problems. One is type 1 von Willebrand's, whereby it's the most common, whereby the von Willebrand factor and factor 8 are attached to each other. They're close to each other, just like you can't do one without the other. They're attached to each other. You can't talk about von Willebrand without talking about factor 8 and vice versa. What you got to understand is that all the factors that I'm going to talk to you during the series, the coagulation factors, are produced in the human liver, except one, and that's factor 8. Factor 8 is produced in the wall of the large vessels throughout the body. You got to keep that in mind. That becomes very important because the liver is the factory that produces all the other coagulation factors. And it's when the liver is sick, that is one of the reasons why I list cirrhosis of the liver as one of the bleeding disorders, even though it's not known as such. But people who have cirrhosis of the liver, because things I will be describing to you when I get to talk about it, bleed profusely because of cirrhosis of the liver. And I'll explain to you why I list it as a bleeding disorder, even though it's a liver disease, but it can cause, and oftentimes does cause, severe bleeding. And the bleeding, quite frequently, in fact, is one of the reasons why the people die from it. Because when the liver is sick, it cannot do its job properly, which is to get rid of all the toxin that passing through it. And of course, once blood get into the system, and of course the blood get worked on by bacteria in the colon, you produce a substance called ammonia, and the liver is not able to handle it, and people develop hepatic encephalopathy, and they go into coma, and they die. Okay, so that's, even though I'm not yet ready, there's a whole lot more to talk about cirrhosis of the liver. I'm just giving you a little taste why I listed there. Now, so that's type 1. That's the most common type. And it's then this type, the level of von Willebrand factor is low. That's all. It's just low. It's the mildest form. It's the most common. It's the mildest form of condition. Yes, you could bleed if you are challenged, but your possibility of bleeding spontaneously from it is less likely, even though it can happen. Then you have type 2, Van Willebrand disease. Now, type 2 is very complex, really complicated, because here what you have a situation whereby the Van Willebrand factor is there, but it's not working properly. Okay? The quantity is there, but it's not working properly. That's the abnormality. And it has several different subgroups attached to it. You have, and you have type 2A, type 2B, and then you have type 2M, and you have type 2N. Don't ask me why, but those are the people who does research that's labeled these things. These are the different subgroup that of people who have type 2 Van Willebrand disease. It's very important to know the type because the management and the treatments are different based on the type. Type 3 is the most serious one, really, very bad. The factors are low, both factor 8 and factor, the Van Willebrand factor and factor 8 are very low, and this is very serious. So these are the subgroup, and the way we go about determining that is when we do laboratory testing, which I'll be discussing with you as well. So the take-home lesson is, since Van Willebrand disease is so common, 110 million folks, 2.8 million in this country, and it's a platelet quality issue. It's a qualitative platelet problem. The quantity of the platelet is fine, but the quality is bad because you need Van Willebrand factor to help the platelet to aggregate in order to form a clot. Now, before coming to the studio, as I was having breakfast, I took a baby aspirin, as I do every day. Well, as I sit here talking to you, I have given myself Van Willebrand disease. That's right, acquired Van Willebrand disease because I took the baby aspirin that I took before coming here, because I was having breakfast. Because that's the reason why I took it. Not because I want Van Willebrand disease, but can't help it. That's a side effect of it. Because the reason why I take the aspirin, because the aspirin will prevent my platelet from aggregating, causing clot formation in my coronaries and my vessels in the brain, etc. That's the reason. In addition to that, the aspirin not just prevent the platelet from aggregating, preventing the formation of the clot, it also causes inflammation to be decreased in the body. Okay, because in order for plaque to form in one's arteries, there has to be an inflammation. Okay, there has to be an inflammation. The beginning of plaque formation, be it in the coronaries or arteries anywhere around the body, in the brain, down the legs, in the rest of the body, etc., there has to be an inflammation. Well, aspirin is fantastic in blocking that inflammatory process. And so doing, it also prevents plaque from forming. Because once you interfere with the smoothness of the vessel, that's going to create an inflammatory reaction. Let me give you an example. It has been documented and proven. People who have bad teeth, even people who have caries in their teeth, that inflammation in the mouth increases the chances of developing clot in somebody's coronary arteries. How so? Well, it gets into the bloodstream, gets circulated, the bloodstream takes it around the heart, and it has inflammation. All inflammatory diseases, from lupus to sarcoidosis to scleroderma, just name all the rheumatological diseases, cause someone to have a higher incidence of coronary artery disease, strokes, etc. Because I just explained the mechanism to you. If you have a chronic infection in your body of any kind, be it chronic osteomyelitis or chronic whatever, you're spilling inflammatory material into the bloodstream. And that then is going to be carried away through your vessel, because that's how the blood gets circulated. And then you have a high incidence of developing plaques as well. Okay, now that's one good thing the aspirin does. Another good thing the aspirin does, the fact it prevents platelet from aggregating, which is why I take it. That's why millions of people take it. However, before you take the chance of taking aspirin, you really ought to speak to your doctor or whoever your healthcare provider happens to be, because he or she will evaluate you and tell you whether or not you are suitable to take the aspirin. Because I just explained to you, 110 million people have von Willebrand disease, plus a whole lot of other things that I just outlined for you. All these are bleeding diseases, and people are walking around with them. Some of them don't know that. Most of them don't know they have it. So they take aspirin. It's over the counter. You buy it. You hear on television that it's good for you. You take it. There's no problem with that. Aspirin is fantastic, but you must discuss this with the person that's providing health care for you to make sure that you have been screened properly, that your aspirin isn't going to hurt you, because you could bleed like nobody's business by taking aspirin. If you have any one of these underlying diseases. So it's very, very important. Okay. Having said that to you, then you see how important it is. Let me give you another example. I'm giving you an example. You have a lot of menstruating female who have menstrual irregularities, and some of them have excessive menstrual flow. Okay? You have other women who have severe cramps during menstruation. Well, they've known over the centuries, over the millenniums, that if they take an aspirin, it decreases the cramp. Now, in modern time, in addition to aspirin, we have all this NSAID, non-steroidal anti-inflammatory medication. So women would take that. It decreases the intensity of the cramp. That's why they take it. Well, time out. Extremely important. And the reason why it works is because the NSAID and or the aspirin has certain properties that allows it to work via the prostaglandin mechanism to decrease the contraction of the uterus, because the uterus has muscles in it, smooth muscle. Okay, by working via the prostaglandin system, you're able to decrease the contraction. That's what decreases the pain, through both the anti-inflammatory process as well as the anti-prostaglandin process. So that's why women take it. However, a lot of women have von Willebrand disease. So they solve one problem, which is fantastic. I mean, I have daughters, and I've done all I could, my God, to help them with menstrual cramp, and I saw how they suffer from it. Problem is, it also, if they happen to have one of these conditions, it's going to increase the flow as well. So they solve the cramping problem, which is a fantastic thing to do, but they increase the flow, because if they have von Willebrand disease, and according to the literature, and also mentioned in this book, in the section on OBGYN, according to the literature, some 15% of women who have fibroids, and you have to understand how common fibroid is. 70% of black female, 40 and older, have fibroids. 50% of Caucasian female, 40 and above, have fibroid. Well, the fibroids cause a lot of issues having to do with GYN symptoms. Okay? One of the problems that attached to that, unfortunately, 15% of these people have von Willebrand disease. So they go to the GYN doctor. The GYN doctor does what often do to try to help them. Some of them need surgery. Some of them just need medication. Some of them, they give them a birth control pill type medication, or Depo-Provera injection, whatever, to try to decrease the size of the fibroid and also decrease the flow. Well, here you go. Problem is, the reason why it works to decrease the flow in those who don't have von Willebrand and other bleeding issues, frankly, is because the steroid that's in the pills causes an increase in the factor 8 von Willebrand. Okay? Because steroid, remember the estrogen I meant to say, estrogen I meant to say, can cause you to clot. That's one of the things that it does. By increasing a little bit the factor 8 von Willebrand, it decreases the menstrual flow because it have a clot to form. Whether or not these people are aware of that's why they're doing it or not, I don't know. But based on what women told me, it decreases the flow. Okay? So you understand how important these things are. So it is not just something that, this is not theory. This is practical stuff that people have to deal with every day. And unfortunately, by knowing just the basic, it's not enough. I'm fully aware as a medical educator that you have to let people go through the basic. You can't keep them in school forever. You teach them the basic, then it's up to them to go out there and either keep using the basic to work and make a living, and or to go beyond the basic by taking it upon themselves to read, to go to lectures, to go to meetings, scientific meetings, etc., and read the literature, get more experience, and so on, so that they can add up to the basics, so that they can do some of this stuff. Just because the basic covers you doesn't necessarily mean that is all you need to know to provide quality care. You can't provide quality care for patients, no matter what specialty you're in, by just sticking with the basic only. That doesn't happen. And believe me, I know, and I have high respect for all my colleagues who are there, who are doing an outstanding job there. Medicine is a very, very stressful, difficult profession, and it's an everyday thing, and they're doing extraordinary work at the front line, providing high quality care for patients. No question about that. I'm proud to be part of this profession, okay, and I'll continue to make contribution as long as God allows me to be alive. Now, therefore then, the point to be made, since all these 15% of these women, it is said they have fibroid, yes, but they also have Willebrand disease, it is the responsibility of the healthcare providers, in this case the GYN doctors, to screen them. And if they don't know how to screen them, send them to hematologists to screen them. By just doing the prothrombin time, the partial thromboplastin time, which is what is they put you on the sheet just before coming to the studio. A patient of mine is getting ready to have surgery. She brought me this pile of paper. As I several times a week, all they want is the blood count, blood chemistry, a prothrombin time, a partial thromboplastin time, and R&R. And that's the basic. I just did that this morning. That's the basic. That's the standard of practice. But there's much more to it than that. Because if you don't evaluate the patient's platelet, the quality of the platelet, you're going to miss that diagnosis. The patient is going to bleed excessively. Okay? But if you do a vitamin C level, you'll be able to pick up the fact that the patient have low vitamin C, which can cause people to bleed. Also, okay, you do a bleeding time. I mean, a bleeding time is pretty simple. Pretty simple. You don't have to do a whole lot. You could just stick somebody's finger and you do a bleeding time. The bleeding time is you use a stopwatch. It's measured in seconds. And if it's more than 7 seconds, it's abnormal. Right away, that raises a red flag. because the other tests that are done for evaluated platelet quality are expensive and extensive. But if you do a bleeding time, which takes, I mean, come on, give me a break. It takes less than a minute. You know, I mean, okay, it's a little bit more than a minute. I'm just exaggerating a little bit, but it doesn't take long to stick somebody's finger with a lancet and do a bleeding time. Why bleeding time is not part of the basic profile to prepare somebody to the operating room is beyond me. I have nothing to do with it. I'm not the one who created these things. I have no idea. I just follow the protocols. However, every now and again, I decide based on the history I take from the patient, this is somebody who has a history of bleeding. So I go beyond what is required to find why the patient is bleeding. Because if you just have, you could have a normal prothrombing time, normal thromboprostin time, normal INR, and you're still going to bleed like nobody's business because nobody bother to check you to see if your vitamin C is low, if your quality of the platelet is normal or abnormal. And you have, I mean, come on, give me a break, okay? All right? So, and then when they start bleeding on the operating table, they're looking all over the place. People have been taken back to the operating room looking for why they're bleeding. They're bleeding because they have a problem that was not picked up before they went to the OR. Okay? I mean, this is, I'm not criticizing. I'm just telling you what it is. I practice medicine every day. I just fill out the form this morning, okay, before I come here. This is how it's done. It's not me. I got nothing to do with it. I just follow the rule. You better follow the standard of practice. If not, the next thing you know, somebody is coming after you. In any event, I have several weeks here to talk about bleeding. So I'm stopping here. Until I see you again, this is Dr. Alcena saying so long and bye-bye.